Welcome to Eye Contact, a video news program on issues and controversies in ophthalmology, sponsored by EUROTIMES. I'm Oliver Findl. We're here at the 33rd Congress of the ESCRS in Barcelona. This year, the EUROTIMES Hanahan Prize challenged young ophthalmologists to write an essay on how the student learns to do surgery. We're talking about this with Dr Soosan Jacob of Dr Agarwal's Eye Hospital in Chennai, India. Dr Jacob also writes a surgical teaching column in EUROTIMES and also has her own educational surgical YouTube channel. Hello, Soosan, how are you doing?
Thanks, Oliver, for having me here.
Thank you for coming. One of the things we see in these essays by young ophthalmologists is a universal excitement tinged with nervousness when facing the prospect of doing surgery for the first time. Do you have any suggestions for teachers or students on how to get through these very early stages?
Yeah, I think, Oliver, actually learning how to do surgery for the first time is, a mix of anticipation and a feeling of dread for most people. And the key to overcome it is just to prepare, and prepare. Read as much as you can about what you're going to be doing, watch videos, watch your teachers do the same thing over and over and over again till you're absolutely comfortable with at least how you're supposed to do it. Mm-hmm. And I think from the teacher's point of view, it's important to be gentle and patient and try to remember how they were sometime back when they were at the same stage probably. And also to kind of break down each surgical step into very analyzable pieces and, try to explain to the student not just how to do it, but also the why and the when to do a particular step. Mm-hmm. Many times the why to do a particular step is the most important key because it kind of teaches you how to improve yourself. Once you understand why you're doing a certain thing, you improve on yourself more and more, and you're able to overcome most situations then.
Right. I mean, for example, when I learned surgery the old style, we started from the beginning and we had to go as long as we could, and then obviously the capsular rhexis was often the end of surgery, right. And you had to be taken over. So what is your strategy? How do you go about, for example, cataract surgery with a young, just a trainee who's starting?
I think pretty much the same way. We give them steps bit by bit. Of course, now there are a lot of wet labs, so that's a big thing for them. And the simulators, the surgical simulators, all these help. And I think most of the younger generation is so technology savvy. They're literally born into technology. They have it in every part of their life. Yeah. So they go online and they see surgical videos and things like that. So many a times they're much more prepared than you really think they are.
Yeah, I mean, I hear from many surgeons now, and actually that's the way I also train my trainees, and I'd like to have your opinion on that, is actually to start from the back to the front. For example, just doing irrigation aspiration after you've put the lens in, and once they've done that a few times and they feel confident, then to actually do IOL implantation and then...
I understand. I think that's actually a very good strategy because, the first step, the rhexis, as you say, after the surgical incisions, is one of the key steps. Yeah. And if your rhexis is not perfect, it's likely to be a downhill, a point from there. Things are likely to go bad to worse and worse. So if you can leave that step to the more experienced person and then, kind of give small steps like a hydrodissection and then, take over for the nucleus sculpting and bring the nucleus pieces out, give it back to them again to, emulsify it, things like that, it makes them feel more confident about the surgical steps and how they're going to handle it.
Now, when we read these Hanahan Prize essays, and they're very fascinating, and they're all obviously nearly all about these first surgical steps, I would say, we also see that YouTube plays an important role, and probably also other internet sources. What do you say about that?
Well, as I said, this is key. YouTube is playing a huge role. And I have a surgical YouTube channel, and I see so many comments that come from the young ophthalmologists about, why a particular thing is done, or what suture did you use there, or why did you do this. And YouTube surgical videos are a great way to learn because it's like, actually watching your grandma bake a cake, like being with her and doing it. And, you can ask her again and again, and you can the same way rewind on the surgical video and go back to a step and keep watching that over and over again, which may not be possible when you're with the teacher because of various different reasons. Maybe, it's a surgical situation. The patient is there, it might not be under GA, the patient is, aware of everything that's going on, and so many other reasons. So YouTube is a great way. And I think if you link that along with reading online, there's so much material available online now. If you link the two together, it's a great educational tool.
I mean, it's also, I think, there's something we always watch in ourselves. When you watch surgery the first time, you're looking at completely different things than when you're much more advanced.
Absolutely.
And then you seem to spot things which are important at that stage, which you haven't even noticed beforehand. Right. Is that what you also see with your trainees?
Absolutely. And in fact, it's not just with trainees. If I'm someone who records my videos very often, and very often when I go and just play them back, I see something which I might not have spotted, on table. And it might have been a reflex action why I acted that way or something, or there might be something that's going to teach me something for my next case. So surgical videos are a great way, and I think one important way that you can at any stage of your life improve yourself is also record your own videos and edit them and, go through them and learn from them again.
Let me also ask you something else. I mean, cataract technology is evolving, and especially now, obviously, FLACS, femtosecond laser-assisted cataract surgery is in everybody's mouth, and it's sort of a hype. Now, apart from whether it's actually helpful or not, that's a different discussion, but it's something which is obviously happening, at least to a certain extent, in some also teaching hospitals. What is your view on the problematic situation of having trainees and having a FLACS, which is obviously pretty much automated and not very many manual steps to be done?
Yeah. Well, I think it's got a positive and a negative. It's automated, so it's in a way of a manner of speaking easier for the trainees because they don't have to bother as much about the rexes and things like that. But then on the other hand, if you look at FLACS down in the practical arena, incision making is sometimes problematic even now because the arcus can often interfere with it. And the rexes, if it's not complete, the trainee still needs to know how to handle a rexes that's maybe incomplete in one place. Hydrodissection is crucial in FLACS because if you go ahead doing it without burping the air bubble out, you might just have a posterior-capsular rent before you even realize it. So in many ways, I think FLACS is something that probably cannot be given straight away to a trainee. They need to understand the complete mechanics of it is completely different from normal cataract surgery, which we are all used to and probably which they've seen so many times over and over and over again. And until they've absolutely got used to how it works and what are the pitfalls, it's probably wiser to become thorough with your normal phaco and then go on to FLACS.
I mean, let's say we have a scenario in 5 or 10 years that the laser will do pretty much every step and with high precision as it does now, but also complete incisions and everything. You don't have to worry, and essentially it just becomes an irrigation aspiration,
much like vacuum cleaning.
Yes. Then. Are you worried that maybe not only the young, but also the more experienced surgeons will have a problem that they're just, because cataract surgery is our most prevalent surgery, no question,
I agree.
that you actually also just train your manual skills with cataract surgery on a daily basis, and then the difficult procedures like corneal or
become more of a challenge.
Vitreoretinal surgery become a challenge? I
agree again with that to a certain extent. FLACS may take away the basic surgical skill of a person who's just starting out on his career if that's all he's going to be exposed to. So it is important. For example, we have many residents who are not comfortable with suturing, whereas when I learned suturing was the first thing that we all used to do. So all of us are very comfortable with it. How to convert to an extracapsular when you really need to do it. These are skills that you really need to know. But then, technology is always evolving. So I'm sure technology will come up with something that's, much more advanced and will need surgical skills in a different way, maybe. And it's much like couching went out of practice, and at that time, I'm sure all the couchers were saying, what are these people doing? Why are they bringing that lens out of the eye? Why do they want an opening in the eye? But then you never know which way technology is going to lead. So I think we just all need to wait and watch.
Well, thank you for joining us. For more information on this and related topics, please visit us at eurotimes.org.